Good afternoon. I hereby call this special meeting of the Nacogdoches ISD Board of Trustees to order. Let a record to show that a quorum is present and notice of this meeting was legally posted in accordance with the Texas Open Meetings Act. Please remember that items do not have to be taken in order shown on the agenda, and please join us in silencing your cell phone. The board will now conduct an executive closed session to discuss the items posted on our agenda pursuant to the following provisions of the Texas Open Meetings Act and as allowed by Texas Government Code sections 551.071, 551.074, and 551.129. No voting will take place in the closed meeting. Any action the board wishes to take as a result of discussions in closed session will take place after the board reconvenes in open session. We will return to open session no earlier than 1 p.m. It is now 12:01 p.m.
Testing 1 2. Testing 1 2. Testing 1 2. Testing. Testing 1 2. Testing. Testing. Testing 1 2. Testing 1 2. Testing 1 2. Testing. 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 Testing 1 2. Testing 1 2.
You'll need to be as loud as you possibly can, probably.
Okay. Okay.
Go ahead and try that again.
Okay. Testing 1 2. Testing 1 2. Testing 1
Okay.
2.
All right. We're going to go with that, and I'm going to turn your laptop around.
All righty, sir.
All right, thank you for your patience as we were wrestled with those audio visual dynamics there. We're now going to reconvene into open session. It is 1:53 p.m. The first item on our agenda are public comments. Those wishing to address the board have emailed a request to the district or turned in a public comment request form to district support by 11 a.m. today. This revised procedure was included and made part of the meeting notice. We have 11 requests today. The time limit will be 3 minutes for each person addressing the board, and Secretary Mindy Winslow will keep time for us today. The first person, Amelia Fisher.
I broke one of these last time I had to push it down. Okay, good. Can you guys hear me okay?
Yes.
Good afternoon, and thank you for holding this meeting. My name is Amelia Fisher. I am a local attorney and a Nacogdoches City Council member, but I come to speak to you today in my capacity as a mother, my most important role. My husband Tyler and I believe in public education, and we believe in the Nacogdoches Independent School District. So when the time came to decide where to enroll our 5-year-old son, we chose NISD. Hand in hand with that choice came the conscious decision to place not only his education, but also his safety and welfare in your hands. We chose to trust you with the most important thing in our lives. Our son just finished his second week of school, and he cried just about every day. This is his first time in school ever, so it's been a really difficult adjustment. And we have felt everything that parents normally feel during these tough weeks. Worried about how he'll do, how he feels, whether he's lonely or making friends, whether he feels comfortable and happy, all while remaining hopeful that he's learning and that he's going to be okay. What we should not be feeling is utter terror for his safety and well-being, but we've been feeling that too. And that feeling, that paralyzing fear about whether our son will get infected with COVID and bring it home to his 1-year-old baby sister, and whether they will be the children that end up in at-capacity pediatric ICUs like so many other kids, that feeling is entirely within your control. I beg you, please, adopt a mask mandate. The science is there, you know it, I don't need to rattle it off to you. You also know that many, many school boards from districts not only across the state but surrounding our city have already done so. I don't need to list those off for you. I also don't need to remind you that your job, over and above anything else, is to protect and keep safe the children that parents have entrusted to you. This is one of those cases in which the right thing is clear. Please, please do it. Thank you.
Thank you, Amelia. Our next speaker, Angela Barcarasi. Did I get close? Baccaris, okay. I apologize.
Hi, Angela had to go to a meeting at 2 o'clock, and so I will be reading in her place. I stand before you today to ask that you implement a mask mandate in the schools that you oversee. In March of 2020, I was asked by our local hospitals to begin making fabric masks to help extend the usefulness of medical-grade masks and to ensure that those N95 masks were available for essential workers. The group that I organized has made and distributed over 2,000 masks locally since that time, including 2 full sets for the Nacogdoches High School cafeteria workers. Do you know what it's like to feel helpless in the face of a pandemic and then be told that simply by making masks of 2 layers of fabric you can save lives? And to be told this by medical professionals. Now, 18 months later, Texas leads the nation in pediatric COVID deaths, 59 just in the last 3 weeks. This is not a political issue, rather a health and safety consideration for the good of everyone. What does a mask do? It blocks respiratory droplets from the mouth and nose. A 2-layer cotton mask has been shown to be 82% effective at filtering those droplets. Without a mask, 1 person with COVID is likely to infect 2 to 3 others. Without a mask, 1 person with the Delta variant is likely to infect up to 6 other persons. Simply wearing a mask lowers that number to less than 1 for both. Yes, some people say wearing a mask is uncomfortable. You know what is more uncomfortable than wearing a mask? Gasping for air, coughing up blood, permanent lung damage, being put on a ventilator, bearing a child. Teachers and medical professionals are mentally and emotionally exhausted. We are all tired of this pandemic. You can help by instating a mask mandate for our schools. Help our medical professionals, help our teachers, help our children by helping out our schools stay open with a low infection rate. People are angry about this issue. I get it. They are afraid, and there are no 100% answers. Yes, what the professionals say about masking has been changing as they learn more about COVID, how it spreads, and what it does to the human body. Scientists didn't understand chickenpox or polio when they first started studying them. They are doing the best they can, and as Maya Angelou said, do the best you can until you know better. Then when you know better, do better. We know that masks work. Masks are a simple barrier to help prevent respiratory droplets from passing from 1 person to another. Studies show that masks reduce the spray of droplets when worn over the nose and mouth. According to the CDC, when you wear a mask, you protect others as well as yourself. Masks work best when everyone wears one. COVID is transmitted by breathing. Masks reduce the amount of infectious droplets spreading, which is especially relevant for asymptomatic or pre-symptomatic infected persons who feel well and may not be aware of their infectiousness to others.
Ma'am,
Thank you.
time.
Thank you, ma'am. Our next speaker, Leanne West.
Members of the Team of 8, in 1621, during an endemic of malignant smallpox, John Donne, poet and dean of St. Paul's Cathedral, with concern for the health and well-being of his parish, wrote in Meditation 17 that no man is an island entire of itself. Every man is a piece of the continent, a part of the main. And those words ring true today, for in 2021, we are part of the main, a community plagued by COVID-19 and its variants. And as such, it behooves those in leadership positions, like Dunn, like yourselves, to act in a manner that protects and benefits the health and general welfare, not just of the students and the staff of the schools, but also of the community at large. Your position as a trustee is apolitical. You swore an oath to execute the duties of your office, of which there are two, and only two: hire and fire a superintendent and set district policy. You come to the board not as a Republican or a Democrat nominated by party and bound by platform, but as part of the main, your district, or at large, not as a conservative or a liberal or a moderate, not owing allegiance to that ideology, nor beholden to their dogma and their platitudes, but as part of the main. And you serve as a member of the Team of 8, now part of the greater educational community, now part of the main of staff, teachers, and administrators who act in loco parentis, not only to educate, but to ensure the safety and security of those on their campuses and to shield them from harm, to shield them from intruders that would sicken, maim, and kill. In loco parentis, like my former colleagues, English teacher Leah Beth Apt, Coach Nariman Fashid, social worker James Montoya, I have educated students, I have ensured their safety, and I've shielded them from harm. And like you on the board, I've served as a member of the board of this trustee. I've placed before you some information to help you make your decision, and I hope that you will read it. Please note that in the school environment, even vaccinated children and teachers do contract COVID-19. And while those vaccinated students and teachers may be protected against serious illness, they can transmit that virus to those in their schools and in their households, and particularly to those who are unvaccinated, like the teacher whom NISD lost this past week. So I urge you to codify as a part of the dress code that all students, teachers, and administrators and visitors to our campuses wear masks in school and on school properties. It is the only way to shield our children and teachers.
Thank you, Leanne.
Thank you.
Our next speaker is Amy Nixdorf.
Thank you to the board, to Pam Fitch, to Dr. Trujillo for allowing me to address this issue. For those of you who don't know me, I'm Amy Nixdorf. I was a former Spanish teacher in Nacogdoches High School for several years until the special ed department let it be known that they needed a bilingual diagnostician, so I worked with that department for several years. I was also the parent of an NISD student, and I'm now the grandparent of an NISD student. I know some of you as co-workers, some of you as friends, and others of you I know through your reputation in the community or through meetings where I've heard you speak on behalf of others. We all have one work in common, one life goal in common, and that is advocacy. Being an advocate is difficult, and half of the people will always give you grief over your decisions. But you know in your hearts when you make a right decision, a correct decision, and you know that you have to do the right thing. This pandemic that we're dealing with now is a pivotal point where you can make all the difference in our whole community. The easiest, the simplest way to keep our students, our staff, our substitute teachers, and ultimately our whole community safe is to require the immediate use of masks. The use of masks does not infringe on anyone's right any more than the current dress code policy does. and it is necessary to use masks in order to get this pandemic under control. Our hospitals are full. Our medical staff in Nacogdoches is exhausted. Reputable doctors and clinicians are begging for us to mask up. Listen to them. In conclusion, I would like to reiterate the belief that was published by the school board members and listed under the mission statement that all students deserve to be taught in a safe and secure environment. This is a powerful statement. Please listen to the experts in disease control, listen to your own hospital reports, and especially listen to your hearts and require masks now. Thank you.
Thank you, Amy. Our next speaker, Heather Olson-Beal.
Hello, I'm Heather Olson-Beal. I'm an active community member and the mother of 3 NHS graduates. Just last week, I took my son Stuart, who just graduated in June, to New York City and got him settled at Columbia University. I'm grateful for the many NISD teachers who work to teach my children and to create safe environments for them to learn in. I'm also an education professor at SFA. I teach my students about the sacred responsibility that they have as teachers to take care of their students. I tell them how scary it was as a parent to hand over my kids to the care of others. Depending on what was happening in their lives, it was sometimes really scary. I worried about them all day long and was always so relieved when I could see them at the end of the day and find them still healthy, happy, and safe. I come to you today in 3 capacities. 1, to speak in behalf of students who could not be here today themselves and to urge you to reinstate required mask wearing. It is your sacred obligation to take preventive actions to keep students safe. We know that masks reduce the transmission of COVID-19. Only you can make this judgment call for our school district. 2, to speak in behalf of NAC ISD teachers and staff who are sick, who are making their families sick, who are missing work, and who are scared to go to work every day. I talk to them every day. It is your responsibility to keep the staff safe. 3, to speak to you in my role as a teacher educator at SFA. My students will soon be assigned to a mentor teacher at NAC High, hopefully next week. I have spoken with them at length about their responsibility to keep their students safe. I have urged them to wear masks to keep themselves from spreading COVID-19 to their students and their families. I am teaching them about that sacred trust that parents place in them to keep their children safe. But I'm also worried about my college students and their safety. Just like it was my kids' teachers' responsibility to keep my kids safe while they were at school, it is my responsibility to keep my students, even though they are grown, they are adults, safe while they are doing work associated with my class. I do not feel like I can do that if masks are not required at NISD campuses. I worry that my course will be putting my students at risk for getting a disease that has killed almost 700,000 Americans, including 58,162 Texans, 184 people in Nacogdoches, and as of yesterday, Texas is leading the way with 67 pediatric COVID deaths. The mother in me has to remind y'all that 67 kids dying from COVID-19 is not okay. It's completely unacceptable. This suggests a gross lack of leadership at the state and local levels and negligence on the part of the adults in these kids' lives who are supposed to keep them safe. Please use the power that you have to take action to keep all the kids and staff at NISD safe. Please reinstate the mask mandate, either by adding it to the dress code, as some districts have done, or simply by ordering it as a matter of public safety. The community is counting on you.
Thank you, Heather. Our next speaker, Mary Hawkins.
Good afternoon. My name is Dr. Mary Hawkins. I teach at SFA, but what I'm about to say may or may not represent the people who are there and the leaders in administration. I think it's important to say that I'm here as a community member. I've been in this community for 5 years. I've been teaching at SFA for that long. I started my 6th in the fall. I have a sister-in-law who teaches at NAC ISD. It's her first year here. She's taught before, but this is her first year here. And I also have a nephew who's 6 who is unable to be vaccinated. I'm here for them too. I know that people say that you know what the numbers are, but I think it's important that I reiterate I teach community and public health. Every 2 weeks, I get the latest data for my students to show them that it is important. One of the key things we do in health education, health promotion, is that we tell people that they are at risk. We are in fatigue related to COVID. People are tired. They don't want to wear masks. It doesn't matter. We cannot stop making the kids safe. It is imperative that you reinstate the mask mandate. I want to read to you just briefly what the CDC has recommended, and recommended in August before school started. This is their update. Given new evidence on the Delta variant, the CDC has updated the guidance for fully vaccinated people. The CDC recommends universal indoor masking. That means everybody. For teachers, staff, students, and visitors to K through 12 schools. It's obvious what the national leader in health wants to be done at the school level. It's not a mystery. We don't have to wonder what the policy should be. It should be what they're recommending. It helped us the first time around. It will help us this time around. Regardless of vaccination status, everyone should be masked. Children should return to full-time in-person learning in the fall with layered prevention strategies, not zero strategies. Now, the other things that I want to share with you, and some people may have already mentioned this. You know, Texas, we're looking at data, and Dallas and Houston, Harris County, and Dallas, where Dallas is located, that county, they are number 5 and 6 for the most infected counties, most new cases in the nation, not in Texas, in the nation. When I looked at the data today, I found something interesting. From August 23rd to August 29th, there were 27,353 public school students who were infected with COVID-19. That is the biggest one-week increase in the entire pandemic.
Thank you, Mary.
You're welcome.
Our next speaker is Dustin Roan.
So good afternoon. I want to start off by saying I'm not here to downplay COVID in any form or fashion. It's brought to my understanding that the district is paying a lawyer to teach them how to skirt Governor Abbott's mandates, the Executive Order GA 38. The question is, where's this funding come from exactly, and why are we wasting it on teaching people how to break the law? And my other question is, what are we teaching our kids at this point if we're teaching them a little money and a lawyer and they can go around the law and do what they want? There's a video floating around I encourage everybody to watch. A father who's trained in confined space entry with OSHA uses his monitor behind his daughter's mask at a school board meeting and proves that the mask is cutting off her oxygen levels. Also wanted to bring it to you guys' attention that my 5-year-old in kindergarten is already being forced to wear a mask in his class. He informed us of that last week when he brought home a mask that we did not supply him with. I haven't decided what we're going to do about that yet. Another thing, Governor Abbott and Attorney General Paxton are going after schools that disobey their orders. And there is a list. And they're sending letters and they're fighting it. And I understand that our school district depends a lot on state funding. We know last year during the mandate that Governor Abbott was threatening to strip that funding away from people who didn't comply. Is that a risk we're willing to take? Another point I wanted to make, also, we are 2 weeks into the school year, and as a parent with 2 kids in school, I've yet to be notified of a COVID case, so I'm not sure why we're discussing this right now, honestly. anyhow, that's about all I've got for today. Thank you.
Thank you, Dustin. Our next speaker, Tanya Grant.
Let's see, first of all, the statistics, in case anybody isn't aware of right now, per the CDC for deaths in all of the United States, pediatric deaths is 470 kids. And I know someone mentioned there was 67 deaths in Texas, which is terrible, obviously. We have 7 million children in Texas, so the chance of dying from COVID in Texas as a child right now is 1 in 104,777. Car accidents, that's the #1 cause of death in children, in case you didn't know that. More kids die in car accidents than are dying of COVID currently. Also, as far as the masking, I am a dental hygienist. No, I'm not a doctor, but I've been a hygienist for a long, long time. I was trained for a whole semester in infection control, and if you messed up one time in cross-contamination, or maybe a few times, you would get dismissed from the program. So I have a problem with people not changing their masks every hour, hanging them from their mirrors, kids taking them off like this, like my daughter says, to put food in their mouth. They've just touched the outside of that mask that could have corona on it, staph, multiple other bacterial growths and viruses. So, yeah, and what I've witnessed and what I've observed dropping my daughter off and picking her up is about 9 out of 10 of these kids choose to wear one anyways. So we're talking maybe 10%, and the schools aren't, but this is just one middle school. I'm the parent, and I think the school district, you know, they're saying the school has to keep the children safe, to a degree. I'm the parent. I'm personally responsible for the medical decisions that I make for my child. A mask, that's a medical intervention. It's only really meant to be used in the clinical setting. So if you don't have proper training in that, you're risking cross-contamination. So the school is doing everything they can at the current time with dividers and distancing, filtration of the air, hand sanitizers, encouraging tissue use. And my personal belief is that the children belong to the parents, and the parents are the ones who are responsible for deciding what intervention should be used on their children, especially if we feel like the mask may be actually doing more harm than good to our children. And no one's saying in this order, the GA38 order, Governor Abbott, no one has said that the people that want to wear a mask can't wear a mask. This is not an anti-mask mandate. It's a mandate saying that you can't mandate in public schools mask wearing. So the problem I have with that is you can choose to wear a mask. You can wear an N95, you can wear surgical.
Thank you. Thank you.
Thank you.
Our next speaker, Reverend Kyle Childress. The next speaker, Scott Reynolds.
Afternoon. Hope y'all are doing all right. Afternoon, everybody, fellow members of the community. My name is Scott Reynolds. I teach at Stephen S., and I have 2 children in one in NISD, one at charter school who will be going to NISD next year. And I've got one that graduated a few years ago. Okay, I've talked at a podium like this before and made what I thought were logical arguments with statistics and things like that. I have found that those don't really carry the day. And what I'm about to tell you right now, I don't think it's going to carry the day. And I don't have prepared statements. I thought about it, but I just couldn't come up with anything that I thought would necessarily be better than what I knew was going to be here already. You know, and the arguments on both sides. But I'm going to share with you then something that I don't like to do normally. I want to give you anecdotes. And anecdotes are not evidence. But I can tell you that with masks, that last year I didn't catch, normally I catch everything. Usually I get strep throat at least twice. I catch a cold, and I catch a pretty bad case of the flu normally, even with the shot, right? Because I teach college and I have school-age kids. Last year, none of that. Not once. And again, that's just a personal anecdote. It doesn't mean anything other than what it means to me. But I didn't get sick at all. And normally, I can count on it. I count the days until it happens, then I count the days while I've got it. Did not happen last year. This year, at Stephen F., I can say that without the mask mandates, now that has, what you do here has nothing to do with what Stephen F. is doing, but I can, again, just anecdote. We've only been in school for a couple of weeks, and I've already got students, a number of students, that are missing class because they have COVID. Some have just been exposed to it. I've got several that have been ill to varying degrees, one of which fairly severely, not in the hospital. We do get alerts about students that get COVID. That does happen. That has happened more than once in the few weeks that we've been back in school. So again, it's pure anecdote. It's not evidence. It's just what I'm seeing. And so y'all can take that for what it's worth. Now, I know that we've talked about what the governor has done, and that's a consideration. That is absolute consideration. If I understand it correctly, they are holding in abeyance any enforcement of that order currently, if I understand it correctly. I may be wrong about that. But then you got to look at this. What's the right thing to do? You got money, right? That's a consideration. You got to think about that. But what is the right thing to do? Oh, did I get? Okay. All right.
Thank you,
Thank y'all
Scott.
very much. I'll see you later.
Our next speaker is Cassie Kutev.
Thank you to the board for allowing me the time to speak on this issue. My name is Cassie Kutev. Now, I will say, I'm a filthy liberal from Houston, but I'm SFA educated, and so are my children. I have a master's degree in mass communication from this institution, taught by some of the finest educators I've seen. With that, I've taught with rhetoric and digital information. In the age of information that we're currently in, there is a vast amount of misinformation going on, leading to echo chambers of social media and everyone scratching each other's backs with bad sources. I'm going to give you some numbers with reputable sources from the American Academy of Pediatrics, CDC, and the Texas Department of State Health Services. 358. That's how many children have died from COVID-19. That's from the American Academy of Pediatrics. 51,964 Texas students have had COVID-19. The source, the Texas Department of State Health Services. And from the CDC, let's focus on Nacogdoches here. There's an 81% increases of COVID-19 cases. 1 out of every 10 is infected. And we're at the highest rates of infections at what month? August of 2021. This is the highest reports in the county. So I've given you numbers from reputable sources. That has no political leaning. It's the information. But this hits home for me. I have a daughter. She's 11. She turns 12 October 29th. She'll be getting the vaccine for her birthday, as with her brother. She's an athlete. She's in GT. She's smarter than me. But she has asthma and rheumatoid arthritis. Now, what is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease. Because of this, she takes a low dose of chemotherapy drug every week. She injects it herself. She's also braver than I am. Raising adolescents is hard. I get the eye rolls, I get the door slams, I get back talk. That should come as expected. But what should not happen is that any parent should not have the fear of knowing is if their child will be infected with COVID-19. To the board, if my daughter gets infected, she will go to the ICU. there are no beds available. I want you to think about that. There's been previous speakers saying this is a small number of children who died. My daughter could be one of those children. My daughter's life matters. Thank you.
Thank you. We will now proceed with items discussed in executive closed session. Item A is consider the NISD 2021-2022 COVID-19 mitigation protocols. Mrs. Krachewski.
Good afternoon, Dr. Trujillo, President Fitch, board members. I have been asked to do two things this afternoon, and number one is to provide the status of the litigation involving mask mandates, hopefully to provide a little bit of clarification. And then number two, to review some alternative mitigation measures. I have asked Dr. Trujillo to assist me in presenting this information to you, particularly with regards to the alternative mitigation measures, as this particular agenda item, of course, requires that you have a good understanding of the existing protocols that are in place currently. Before we get to that, though, I do want to just provide a little bit of overview for you on the status of the litigation. There are currently 8 lawsuits that are pending that are challenging the authority of the governor under his executive order number 38 to prohibit any governmental entity from instituting a mask mandate. At one point, there were 9 lawsuits pending. The 9th lawsuit was actually the one lawsuit that impacted all school districts in the state of Texas. And that suit, unfortunately, has been non-suited. It is no longer live or viable. And so the one litigation matter that could have provided clarification or eliminated the existence of enforcement of GA 38 as it applies to all Texas schools no longer exists. Just for your information, as you read about these cases in the newspaper, etc., the case that I'm referring to is the Southern Center for Child Advocacy, otherwise known as the SCCA litigation. All other lawsuits involve, for the most part, those communities either in Bexar County and San Antonio, Travis County, in Austin, Dallas, or Harris counties. I believe there's also one in Cameron County. And so those lawsuits are in various stages of the ballgame, but they apply primarily to the school districts that are identified in those individual matters, and they do not apply to any of the school districts in Region 7, including the Nacogdoches Independent School District. So what that means is that the governor's order is live, and it is applicable to this school district and all other school districts in Nacogdoches County. The penalty for violating the order of the governor is written in the order itself. It simply indicates that any governmental entity, of course, again, this applies across the board to all governmental entities in Texas, not just school districts, but school districts are mentioned specifically by name, is a $1,000 fine. So this is not an order that is enforceable by any type of jail time. Unfortunately, the order as written does not provide clarification as to whether the $1,000 is a one-time penalty fee or whether it's per occurrence or a daily fee. So we, until that is clarified, I cannot give you any certainty as to what the penalty is for violating GA 38. As of today's date, I think there are maybe 3 school districts who are implementing mask mandates in the East Texas area. Lufkin, of course, the most recent of which, Diboll, as well as Longview. We're trying our best to follow those with the help of Region 7. You are not alone in your interest on placing an item like this on your agenda, as many districts are considering a variety of mitigation measures, particularly the smaller districts who are having to close due to numbers either of kiddos or faculty. And so most are doing what they can to take a very layered approach. There is some talk In the actual pleadings that continue to be live, that there's a potential for criminal enforcement of the violation of GA 38 by local law enforcement entities. You may have read an article in the Daily Sentinel last week involving eToil's action to consider mask mandates. There, our Nacogdoches County District Attorney was quoted as saying that he has jurisdiction over felonies only and does not have any authority to enforce an ordinance of this nature. To date, I do not believe that there has been any direction given by the state to either the district attorney's office or even the county attorney's offices across the state regarding enforcement. But the statement has been made by the state of Texas that the enforcement would be through the local law enforcement agencies. As one speaker indicated, there is a tracking system on the Attorney General's website where the AG is tracking through media publications of governing entities. It's not just related to school districts, but any governmental entity mandating masks. You'll find lots of counties referenced on that list, but the AG will update that list periodically as he or she becomes aware, or as he, sorry, becomes aware of governmental entities that are acting in violation of GA 38. The governor, when he learns of this information, will send correspondence to those entities that reminds them of the nature of GA 38, the viability of that order, and the potential for the Attorney General's office to attempt to enforce or prevent any governmental entity from acting inconsistent with GA 38 through civil litigation. That, of course, would be in the form of seeking injunctive relief and then, of course, attorney's fees. In that correspondence, the AG recognizes that until all of this litigation is sorted out through the Texas, all the way up to the Texas Supreme Court and back, that there likely will be no enforcement of GA 38 until the issue of which law rules a local school board's authority under Chapter 11 to oversee and manage the operations of a district, or the governor's authority under the Emergency Disaster Act to act in what he or she believes to be in the best interest of the state of Texas. And so until that issue is resolved by the Supreme Court, there likely will be no enforcement of GA 38. At least that's the message or the sentiment that's being conveyed to governmental entities as of today's date. How soon we will receive that decision from the Texas Supreme Court? Again, there are 8 cases, to the best of my knowledge, that are currently alive, each of them at various stages of litigation, having to make their way up the ladder and back down from the Supreme Court and to be heard on the merits. So it could be later in the fall, possibly even as late as the winter, before we have a definitive answer with regards to GA 38. Because of its existence, however, then certainly any action that is brought by the board with regards to a mask mandate of sorts, or an action that would be in violation of the governor's order, could also face, of course, potential challenge by those who oppose the institution of a mask mandate. So that's certainly something that the board would want to take into consideration with regards to any type of risk assessment or analysis. So that's basically an overview of where we stand today with regards to the litigation. There was the one case, the SCCA, which for a very brief period of time did impact all Texas school districts regardless of where you were. But as of August 27th, that case was dismissed, and so there's currently no litigation pending that has any impact whatsoever on a school district in Region 7. Those districts that are involved in active litigation in the larger counties, the Bexar, Travis, Harris, Dallas, those are also districts who likely have a local Department of Health order in place, also mandating masks based upon the high numbers of infections in those areas, so they have that additional layer of insulation. We do not have such an order like that in Nacogdoches County, nor am I aware of any counties in our Trauma Center H is where we are, guys, with regards to our health statistics from the Department of Human or Health Services. When you're checking data on a daily basis, Nacogdoches is in Trauma Center H, along with Angelina, Sabine, St. Augustine, Polk, Tyler, and San Jacinto counties. So I don't believe we have any local health orders in any of those counties as of today. Data shows 4 intensive care unit beds available as of today in Trauma Center H. Okay, any questions first on the status of the litigation? No? Okay, good. With regards to the current protocol measures and other alternative mitigation measures that I'm seeing statewide, you have basically 2 documents, and if you pull up the school district's website, they are prominent right there on the home page. They sometimes will scroll past depending upon whether I'm opening it on my hard drive, on my laptop or my phone. I get kind of a different picture, but they are both right there on the front page. One's referred to as the COVID-19 Smart Start Plan, and the second one is referred to as the ESSER Return to In-Person Instruction and Continuity of Services Plan. The second one is a little more detailed because it was required for the grant money to have more detail in it, but you're going to see the graphic or the chart that reflects the CDC recommendations on the left-hand side and the actual mitigation measures and protocols that are in place. On the right-hand side, you're going to see that chart in both documents. So that's the current state of those protocols. And Dr. Trujillo, would you like to just provide a little bit of an overview real quick on what the district has been implementing thus far in the school year before I jump into what are some options with regards to other incentive or other types of alternative mitigation measures that can be discussed or considered by the board in addition to or in as alternatives to masks, mandates?
Absolutely. Absolutely. Some of the things that we've done that began early in the summer with the leadership was to provide our community opportunity to gain access to the vaccine. So down with the transportation, we were able to provide transportation throughout at least twice where we were able to go into maybe the areas that are a little underserved with regard to transportation needs or anything that our families may need to get to come to get vaccine. So we provided transportation to and from school for both vaccines for families and had some participation with that. At the end of the year, last year, we also, with the benefit from the CDC with regards to vaccinations of 12-year-old or older, we provided vaccine clinics for our students that are 12 years of age or older. We've continued to provide immediate communication and contact and support for our staff, make them aware of vaccines that are available for them, and most recently, including the booster shot that has come out. And fortunately for us, even the new location we have here in Nacogdoches that can provide those that have been tested positive for COVID. The other things that we've continued to have is we've provided the campuses with a measure to take temperature of students. We continue to provide those mitigation steps in our transportation. All of our kids that get on the buses, we have the availability of sanitizer, as well as transporting with the windows open so that we can circulate air throughout the transportation of our families as they're riding their buses to school. We have our nurses currently providing opportunities to test, rapid test our students and staff members as a need arises. We are currently also expanding our nursing services by locating 2 additional nurses that we'll be able to provide on a daily basis, basically a drive-by testing site that will open 6 o'clock in the morning for our staff and our students and also for our teachers. That way, before they get to school, they have an opportunity to test and get a result so that they're not having to go all the way to the school and go into the bowels of the school to find the nurse to get tested. Individual classrooms, we do strongly encourage the use of masks, and we also have plexiglass dividers in the classrooms available to the teachers, and those classrooms that have a little more challenge to the distancing of students in the classroom. Virtual learning has not been an option for us. However, this week we'll be looking for guidance as virtual now becomes an opportunity for us once again as we had it last year. But we know the most important place for the students to be would be at school. We also have multiple foggers that we fog our buses. We also fog our classrooms, deep clean our classrooms wherever we've identified the need that happens within those 12 hours that we've identified. We also are now doing the contact tracing, communicating with families. We got a little more guidance with regards to what does that entail when it comes to contact tracing, notification of families with regards to tested COVID positive individual. Those are a lot of the mitigation steps that are going on. We continue water fountains. Nothing has changed. We still have the cup fillers, the bottle fillers, and we're looking at expanding those as well throughout our campuses. We have also traffic flow within the building is pretty broken up as far as moving students to and from to the cafeteria, to the classrooms, and through the variety of settings that we have throughout the day. I'm pretty pleased. We continually monitor the outcome of our students on a daily basis to find out where we are at. And to date, for example, percent of student positive COVID that we have in the campuses is 1.16% of our student population. And we're sitting at a 3.04% with our staff. All of the mitigating steps that we have continued to work. Any one is too many, but we still continue to monitor and adjust, and we're looking at expanding that even further now to include some additional mitigation that needs to be taken care of in order to meet the needs of our teachers and our classrooms. President Finch or board, anybody has a question?
Dr. Trujillo, can you share with us our current COVID positive cases among students? What is our percentage running at?
Today, as of today, well, let me give you Friday. Friday was at 1.23% of our students that are student positive with COVID. So it's slightly over 1% of our student population. Today, that number dropped a little bit. We had some students that have been quarantined and returned back to school. So it's at 1.16% of our students.
Thank you.
Dr. Trujillo, this is Farshid Niromai. What the threshold should be if we decide to close the schools?
Repeat your question again, sir.
I said,
I'm sorry.
what thresholds of number constitute dismissing the schools for a period of time?
If we go based on what we did last year, these are, we had this conversation as we had a couple of closures last year. It depended on the infection that happened. For instance, if it happened to hit an entire grade level of teachers or students, then we would shut down a campus. And that threshold could be based on 3-4 teachers, but it also could be based on a percentage of if 10% or 7% of a campus became positive, then we would constitute a closure. We fortunately have not had that this year. Our number or percentage has not gone to near those numbers as of yet, and we continue. That's why we monitor it on a daily basis in communication with our president and also with the administration of the Bureau. Where are we sitting at with our numbers?
Thank you.
Any additional questions on current mitigation protocols before we move to the discussion of additional protocols?
Dr. Trujillo, we had those special shields that hung on the teachers' necks and protected them from below when they're teaching the students. Do we still have those? Do the teachers still have them, or do we have any ordered for them to use?
What exactly? Repeat your question again.
Well, we gave out face shields that came from the state, but you went beyond that and found a shield that hang from the neck and came from, so that you would not be contaminated from below when you reach down to talk to a student. The special face shields, do they still have those? Do we still have those? Are we going to get any more of those for our teachers?
Yes, we do have, a matter of fact, if you go on to several of our campuses, notices that some teachers that opt not to wear a mask, but they're still wearing a face shield. And I asked a couple as to the rationale, the projection, and being able to provide the instruction to kids when they're in a full classroom. So some of them are still using the shield that we provided them last year. We did receive one from the state. It didn't adequately meet the needs as what we felt would protect our folks. So we went out and got all of our teachers that shield. So they have access to it. Several are using the shield. We do have some that are using the shield and the mask. It's just a preference based on the individual teacher and how they are utilizing those tools. But we do have access to them. And by any means, if we ever have a need and we do not have them, then we will get with the task force. That task force meets pretty regularly. Once a week or so, that task force comes together to evaluate the mitigating steps, makes recommendations. They look at the numbers that we have, and if it's determined that there is a tool that's out there, then our team is willing to do whatever we can to bring those safety measures in to protect our teachers and our students.
Thank you.
Dr. Trujillo, this is Leah Beth Abt, and I know that we purchased and used all those desk shields last year, and you mentioned them again this year. What's the criteria we are using to decide when we're using the desk shields and when we are not?
Typically, every classroom has access to all the shields. We did not collect any of the shields. We did disinfect and clean them and stored them for the summer. As a matter of fact, some of the programs did use them for summer school. However, each individual classroom, based on the dynamics and the group dynamics, if it's at an elementary classroom and they're at the picnic table, then you'll typically see the dividers are up between each one of the students as they're interacting with each other. It's a little more difficult when you get to the high school setting because the devices, in order for it to work effectively, we would much rather have it travel with the student if they're having to move. Of course, it's difficult with a high school kid walking around carrying a divider. And we do that because of the fact that the hands touch it, they're moving it around. So as far as a set criteria, we would make sure that we're going to go back and revisit the mitigating steps with regards to those dividers because they did prove to be a benefit to our classrooms. And we'll be initiating that a little more consistently across the board. Even though we do have access to them and they're at the preference use of the classroom, we're going to be looking at that being a dynamic tool that can help us, especially when we have 22 little bodies in a classroom and students are sitting behind the desk. The students would much rather sit behind one of those than a lot of times be isolated in other ways. They can actually interact with the teacher very well through the shield. But we do have access for all of them. Matter of fact, our COVID task force has notified me that we have more on way, en route, that will be delivered to campuses and to expand their uses. We did, and my add this as well, it was extremely beneficial also in the cafeteria where we had students come in a larger group setting. We have students, by the way, one of the things that was very observable, a lot of our students are already wearing their masks. The only time you kind of see them popping their mask off is in the cafeteria. It's another great location to put the dividers up so that when students are eating, they have a little bit more protection from each other as they're sitting in the cafeteria or in large areas.
Dr. Broman again, Dr. Trujillo. As I recall, last year on the buses, we want to move out of the classrooms to where we transport large numbers of students. As I recall, we had hand sanitizer available as they come onto the buses, but didn't we do something also where we put the windows down? I don't know if that was last year or this year, but what are the things we're doing in the buses and doing safety measures for our students?
Exactly. We've got the same measures. Matter of fact, all our bus drivers were trained early in the year. The one thing that we did deviate from was the individual temperature checks that were happening as students came on the bus. But the hand sanitizer has become something of a regular routine. The students, they're already used to it. You come in and they use that device. But right now, the weather's been beautiful, and the windows on our buses are down, and we're airing out the buses as we're transporting our students to and from school.
As you were talking, something else came to mind. We have the smart pass or smart bus, the thing about how we keep up with our students on our buses now. But there's actually a COVID program in there to make sure that the driver is safe. Isn't that correct?
Yes, sir. Matter of fact, we can track the flow of our buses, and that's a smart tag system that we have. And all of our drivers are fully masked. Matter of fact, if you're driving down one of our Nacogdoches roads, it'd be highly unusual to see our drivers not wearing their masks. We continue to heavily encourage and strongly encourage our folks to wear their masks. And it's pleasing to see a lot of our adults and even our kids. It's very exciting to see them in compliance with that. So absolutely, that smart tag has been a tremendous asset for us. It's in the efficiency of making sure that we can run the best route, so our students are not sitting in the buses any longer than they need to as we're transporting them from home to school or from school back to home.
Thank you.
All right, Ms. Karchevsky, I may ask you, as we move into item B, consider the resolutions authorizing additional COVID-19 mitigation strategies. If you would review those resolutions with us.
Yes, ma'am. I have prepared for the board's initial discussion and dialogue two of the most common resolutions that we are seeing passed by local school boards across the East Texas area, sometimes in addition to a mask mandate, but also oftentimes prior to the institution of a mask mandate. As Dr. Trujillo indicated, oftentimes the indicator for school closure is triggered not necessarily by the student population and the numbers of illnesses, but rather the staff. And so the first is a COVID leave resolution that is designed to keep your employees healthy and in the classroom. Last year, due to federal law, districts were required to guarantee your employees certain additional leave for COVID-related illnesses or required isolations. Of course, that federal leave has since expired. What this proposed resolution does is basically provide that additional leave on behalf of the local entity as opposed to the federal government. And so this is just a one-page, real quick little resolution that tracks the ability of the school district to do what you feel is best based on the purposes necessary to the conduct of public schools, your interest in wanting to keep your employees healthy and safe, and most importantly, by providing this additional leave, it encourages and incentivizes employees to test quicker. In other words, if they are exhibiting the symptoms of COVID and they know that if they test positive, they will have additional leave days available to them while they're required to isolate, then they are more likely to go and get the test. Whereas if they do not have the leave available to them, then they may not test and continue to come to work with the symptoms, or they may not test as soon as they otherwise would. And so this incentive hopefully will allow or encourage your employees to test sooner, and if they do test positive, your protocols as required by TEA will insist that those individuals, if they are symptomatic, that they stay home for 10 days from the onset of symptoms. If they're asymptomatic, that they stay home 10 days from the positive test. So your administration has recommended 10 additional days of leave. You'll note in the copy that I have in front of you, board members, I've actually highlighted the pertinent provisions that are unique to Nacogdoches. So we've got 10 additional days. It applies to all regular employees, both those on contract and those not on contract, both salaried and non-salaried. Importantly, though, it's only for the employee. It's not for the employee's family when a family member tests positive, but only the employee. And it's only for a positive test. It would require treating physicians or some type of positive test for medical certification. And the required time period, again, is 10 days, or the limited time period is 10 days.
Dr. Trujillo, what would the cost of this additional paid leave policy possibly incur to the district?
Great question, President Finch. I gave the instructions to my leadership team to look at worst case scenario. I wanted to make sure that each and every staff member and teacher that we have that's working within the district, that they have an opportunity to have 10 days that would be provided to them if they were to be instructed to isolate. And isolate meaning until they are symptom-free. And taking that tabulation for every employee in the district, staff and teachers, would run approximately $710,000. And that's if every individual in the school district took the 10 days. We by no means anticipate that to be, but we want to make sure that we provide that opportunity for every staff and employee in the district that would get 10 days if they had to isolate personally because of a positive test. And so that's the number, the figure that we would arrive with is approximately $710,000 that would be coming from fund balance.
Dr. Trujillo, now if an individual, one of our staff has had COVID prior to this, will they still be covered with those 10 days?
If you talk about retroactive from today?
Right.
Yes, sir. What we are looking at is anything that happened this academic school year. Had to have been this year, it would not go into the next school year or the previous school year as far as days lost. And we want to make sure the individual knows that we see value in the decision that they're making. What we don't want is an individual that doesn't really want to test themselves because they're afraid they're going to be missing work and they just feel sick. They don't want to. They don't feel like they have COVID. Well, we want to make sure we can provide them with a safety net to say, test yourself. If it turns out to be positive, regardless of what the state is not doing. The state is not providing us the 10 days like we did in the past, and although we still have COVID occurring, and this sends a loud message saying we value you, and any individual who started with Nacogdoches this academic school year, beginning the first day they reported on the job, and that was right before kids arrived. We had staff development that ensued, and we have folks that may have started with a negative number of days, and they're worried about the remainder of the year. Well, with this would be retroactive for those individuals, and thinking of all of our future days, hoping that if we don't use it, but preparing for the worst.
Dr. Trujillo, this is Farshid Niroman. That person has to be diagnosed by a physician and also released by a physician. Am I correct?
Well, the first thing we do is once you test positive, then you'll get a report, and that document is, if you run the testing, you'll get a document that tells you you tested positive. That document is immediately handed over to HR. Your clock starts ticking at that point, and that's something that confidentiality remains of the utmost importance. It's something we're not sharing, but we do need to make sure we put that in with human resources, and the clock starts ticking at that point. And it just depends, because people are the onset, now that we have some new tools in Nacogdoches, some folks may decide to go take advantage of the infusion and they'll be good within a few days, as long as they're symptom-free and have been released to come back to school, and not running a fever and doesn't have any of the other symptoms. They may not use the entire 10 days, but we're allowing that for them to use just in case they do need it. But Coach Rashid, as soon as they're being tested, they'll get a document that says you're positive, COVID positive, and that document is in our guidelines has been shared to please communicate with HR, and at that point, that's how we would be able to address it.
Okay, thank you.
Dr. Trujillo, are we continuing to provide rapid testing for our employees and students who suspect they are having symptoms? But
absolutely, yes,
okay.
Absolutely. Every single opportunity, any employee that has a feel that they need to be tested, we are providing them with a rapid test. But what we're also doing is, this is where we're deviating and creating a little more of a tiered system, is we've expanded our nurses, and now we have an off-site nursing location where we will begin testing our employees, possibly even students that want to drive themselves or parents want to bring their child by. And the nurses will be there just to test the students, and they will know within 15 minutes. Currently, if a teacher is feeling ill, they will make it to school, and then they'll make it into the bowels of the building and maybe go see the nurse. At that point, the nurse tests them, and if they're tested positive, now we have to go back and do a kind of locate where was the teacher, who she had proximity with. But by doing this off-site, we will be able to provide the rapid testing, and the supply is endless. All we have to do is submit that to the state, and they will provide us with additional rapid testing that we can administer for any employee of the district, as well as any student or any parent that needs it. Might add, we did this last year as one of our mitigating processes, but we only did it one time in the evening, and it was rather difficult. If a mom wanted to test her child and they'd been home, if they weren't available for that one night, then they missed that window and had to look for another testing site. What I'm proposing is we will have a testing site that will run 5 days a week, Monday through Friday, beginning at 6 o'clock in the morning in the same location, so that employees can drive there or family members can drive their child there to get tested. That way they don't enter the school, and then we have to determine if they are positive, and then we have exposure. This is one of the things that we're doing, is to just expand the opportunity to do it off-site in a location with our valuable nursing staff, which we are expanding by 2 nurses to make this happen. So rapid testing is ongoing, and we can continue to ask for additional testing as the need arises.
This is Dr. Groman. This is, the school district pays for this, right? This is no cost to the student or the teacher or like that, right? And we're going to pay for that.
It's completely free to our families and to the employees. The state provides us, they tell us what is your number, what do you need, and we send in, our task force meets regularly to determine what do we need in order to meet the needs of our families and our staff. And so it's at no cost to any of our employees or to our students whenever they need a rapid test. Even athletic programs, any group that wants to test their group before they go to a function or travel, we're going to provide them with the rapid testing. I might also add, Dr. Groman, this is also with vaccines. The minute we're identified that a vaccine is needed, we've been having a really good relationship with the chief here in Nacogdoches, as well as the SFA and the nursing staff, where they'll come out and we will provide a vaccine clinic. Even if it's one student that is interested in the vaccine and we are made aware of that, then we will provide them with the opportunity to get the vaccine. And we're pleasantly surprised every time we do this on the number of staff members, as well as students that are rising and taking advantage of the vaccine.
Thank you.
That might lead very well into the other resolution that you had brought to us, Kelly, a vaccination incentive. You want to go over that with us?
Yes, ma'am. Board members, the vaccine incentive resolution is a little longer. I did print it for you front to back, and I also highlighted for you the information that was unique to Nacogdoches. You'll note that there's quite a bit of information as a lead-in to the desire or interest of you as a school board to institute a vaccine incentive. Again, it's grounded primarily in your employees and needing your employees safe and healthy so that they can stay in the classroom to deliver that instruction. The information that you have on the front page deals primarily with the statistics that are on DISH's website that will be that's typically updated every afternoon at 4 o'clock. You've heard some of the numbers already from your speakers. And then also towards the bottom, it just kind of tracks the timeline of when the vaccines were authorized for emergency purposes. And then also your Pfizer vaccine, of course, has full FDA approval now. And then on page 2 is where we get to the beef of what you are authorizing on behalf of your employees. And let me just kind of break it down for you. What's being proposed for you today is basically a vaccine incentive stipend. It's a one-time payment of $500 to be issued to all eligible district employees who provide proof of full vaccination. We've included in here a 30-day time period, so you're talking about 30 days from the date of the board approving the vaccine incentive program, or for any employee who comes in after that time period, then 30 days from the date of hire. So basically, you're giving the individual, if they already have proof of vaccine, then great, they produce it right away and they've done all they need to do. If, however, they've not been vaccinated, it gives that 30-day period to get vaccinated. So the proposal then, of course, is 30 days. The amount of money is $500. Number 3, I'm sorry, is where we define eligible employee. And here, the administration's recommending all full-time and part-time individuals as of the effective date of this resolution, including permanent subs. So not just everybody on your sub list, but rather those individuals who are, again, identified as permanent substitute teachers who are here and interacting with other employees and students on a regular basis. Number 4 is in recognition that there could be individuals who have medical exceptions that prevent them from getting vaccinated. If that's the case, we have included that as an exception. Those individuals, if they're able to provide medical certification to provide, justification for why they're unable to get vaccinated, they can still qualify and receive the stipend. They would, in lieu of that, though, need to agree to undergo weekly COVID testing and then completion of safety education and training program, which can be done online. The proposed date of the distribution of the vaccine is prior to the holiday, which would be November of 2021. And then paragraph 7 basically is the expectation that any employee who receives a benefit from this incentive program is expected to remain employed throughout the 21-22 school year. And if for whatever reason, whether through termination or whether they voluntarily resign, they agree and consent to have the amount of the stipend withdrawn from their last paycheck in the event that they do not continue in employment. Should the board approve this resolution or one similar, we would create an acknowledgement and consent form for each employee to sign that would authorize that withholding and just an agreement to the terms of the vaccine incentive program.
I have a question about this stipend.
Yes, ma'am.
Because we sometimes get new teachers in the spring, and we often get new permanent substitutes in the spring. Would we need a new resolution for those additional ones in the spring, since this is like paid off in November?
That's an excellent question. I don't want to speak for Mr. Martin, but in prior dialogues, the thinking was that the incentive would be applicable even to those hired after, simply because the intent would still be there to make sure everyone's safe if they're on campus and interacting with students. I would probably want to defer to you as a board, however, because the data and the statistics could be different in the spring. We could not be in a state of, crisis. We could be past the current variant. Of course, we could have a different variant that we're looking at. And so I think that if we wanted to address what transpires after November, we could either include that language in the resolution, or we could simply defer to that paragraph number 8, which basically gives the superintendent the authority to implement the resolution as intended by the board, and then the superintendent could do so in the spring based upon direction from the board for any hires in the spring, based upon the data at that time. The amount of financial requirement to implement this, of course, would differ based upon additional hires, but I think, Dr. Trio, you have that number as well, right?
Yes,
With your
ma'am, we're
existing
talking about $578,000 that would meet this need, and it would also come from the fund balance. And it is also, we have individuals that have already received the vaccine prior to this initiative being launched, so it's being respected by those individuals as well as any future folks that will do it between now and the scope of the project.
Importantly, we are able as an employer to inquire as to our employees' vaccine status, but we are not allowed to require that they respond. We cannot mandate vaccines, nor that any individual employed by the district indicate affirmatively or negatively their vaccine status. They have the right to keep that information confidential and private. The EEOC supports vaccine incentives. You're probably reading about them, even by private employers. We have to ensure that the incentive is not so large as to be coercive, to almost force an employee to feel as if he or she has to do it. And so the $500 amount is pretty traditional. I'm seeing that number quite a bit across the state. The higher you go, the closer you get to that coercion. We also have to be careful about, we don't want to give away "I've been vaccinated" T-shirts or anything of that nature, because that would again reveal the confidential nature of an individual's vaccine status. So no jeans on Friday for those vaccinated or anything like that. But this is just a private way, a confidential way of incentivizing the vaccine status, making it a little bit easier, coupled with having the clinics on campus to do the vaccines. Hopefully we'll keep your teachers primarily, but those folks who interact with the students and each other on a regular basis safe and able to stay in the classroom and keep the schools open.
Dr. Trujillo, do you have anything you would like to add about the incentive?
No, ma'am, other than the fact that the distribution would be it would be completely private. It would be in the form of possibly the November payroll check, which would be slide in there into the employee that has communicated this. Very important for what you heard with regards to employees that choose not to. Once again, this is not mandatory. It's not. We're not making anybody get the vaccine. We're just providing an incentive for those folks that may want to take their vaccine. And once again, this is one of those additional mitigating steps. We're providing the opportunity to vaccinate all our employees. We're also looking at the opportunity to provide them days so that if they need to take some days to get better, then they can take the days that are there. These, in addition to the current mitigation procedures that we're looking, will make us that much more effective, as well as the off-site testing location that we are in the process of initiating are all measures that will help us be as successful. President Finch, you asked earlier, what were the numbers? We're sitting at 1.16% of our students, and we're sitting at 3.04 of our teachers %. Those are very good numbers. But 1% is too much, but still, those are tremendous numbers of the mitigating steps that we're taking, and I applaud the efforts of our teachers and our staff and our maintenance and operations, custodial staff. All of those folks are doing a tremendous job, and by doing these incentives that we're proposing, it steps also forward to say that we will do whatever we can to help our teachers remain safe and secure as they meet the needs of our kids.
One last thing, President Fitch. While we cannot institute within an incentive program something that would reveal an employee's vaccination status, we are seeing lots of just fun, different mask incentives happening on campuses. And so principals, teachers can certainly institute any type of incentive that might encourage mask wearing, particularly if we have those masks available and at the desk. You know, the punch cards and the crazy sock day and the hat day and the jeans Friday and the get out of whatever duty day kind of a thing. So those are happening as well. And there's nothing that prevents those for purposes of mask mandates. But ultimately, it would be my recommendation that if the board elected to implement a mask mandate, that it certainly be something that is an action that would be taken by the board as a whole after careful consideration of the risk factors associated and a balance of your public policy issues that you're discussing today. Anything else of me?
I have a question if I could ask one.
I'm afraid we cannot. We can entertain questions from the board.
Now, what was her question? I didn't hear. What was her question? I didn't hear.
What was Kelly's question?
Oh, Kelly's question.
Is that what you're asking?
Well, I wasn't sure what she was asking, what the member in the audience was asking.
He was asking if he could speak.
Oh, okay.
I said a quick question.
Any additional questions from the board members?
Well, in reference to...
Anything additional of me? Any questions for me before I
don't think so.
Okay.
Madam President, could I make a resolution?
Yes, sir.
Madam President, now therefore be it resolved that the Board of Trustees of the Nacogdoches Independent School District authorizes providing 10 additional days of local paid leave for the salaried and non-salaried for all regular employees, contractual and non-contractual, salaried and non-salaried, when the employee tests positive for COVID-19 and is required to isolate as directed by a treating physician. And be it further resolved that the Board of Trustees requests and hereby authorizes the superintendent to implement the COVID leave program consistent with this resolution and as necessary to address the potential danger of COVID-19 in our schools without further action. And this would be under COVID leave resolution. And next time I'm going to wear my glasses.
Take that as a form of a motion.
Yes.
All right. Do we have a second?
I'll second.
Okay, we have a second by Mrs. Winslow. Point of clarification, Kelly, if I may. He read a portion of the resolution. Does the resolution in its entirety need to be read into the record?
That is always my recommendation for purposes of transparency. I think that while we will, of course, attach it to the board minutes, I think it's important for the public to hear the entirety of the resolution today.
All right. I'll go ahead and...
You want to read it?
You've got your glasses?
I've got my glasses
All right.
now. I get mixed up. They look alike. Okay, so I'll start at the top and go to the now therefore. COVID leave resolution, Nacogdoches Independent School District Board of Trustees. Whereas the board is authorized by East Texas Education Code Section 45.105 to expand funds of the Nacogdoches Independent School District for purposes necessary in the conduct of the public schools as determined by the board. And whereas the board acknowledges that during a pandemic, district employees may exhaust available state and local leave days, and whereas the board finds that a need exists to address additional leave in the circumstances of a pandemic, and whereas the board concludes that providing additional paid leave to all regular employees, contractual and non-contractual, salaried and non-salaried, who test positive to COVID-19 and are directed to isolate by a treating physician serves the public purpose of protecting students and staff and maintaining morale. And then that goes into now therefore be it resolved.
All right. Any discussion on this item? I'll call for the vote. All those in favor, please indicate by raising your right hand, saying aye.
Aye.
Any opposed? Motion carries unanimously.
Madam President, I'm not sure if this is a point of order, but I would like, after we heard from the community about the mask, I think that we need to, what are we going to do from here on?
Or is that in the form of a motion?
I'm asking that we consider a mask mandate as explained to us, and that we proceed for 45 days with the mask mandate and cleaning up our schools, and if necessary, to close the schools until we can get it to where it needs to be done. That's what I would like to see happen.
Okay. And that effective date would be?
Well, I think that we need to, look at what the process will be for us to be able to get the school cleaned out and all that. So I think that we would have to come up with a date as soon as possible. I would like to see that happen.
All right. Kelly, can you help me out with that? Do we need an effective date in that motion?
Well, you need, the way I would perceive it is either Mr. Montoya is making a motion to consider a mask mandate effective today, or at a date future, or maybe he's making a motion to place it on a future board agenda, the actual issue of a mask mandate.
Well, I'll actually
by
like to make
itself.
the
So
motion
if you
to-
would like for the board to deliberate today the issuance of a mask mandate, I think it's okay to leave that effective date kind of up in the air and part of the discussion, but some clarity on the motion, I think would be
I want to
necessary.
make a motion that we have a vote on the mask mandate
Okay.
with different dates that we need to implement or whatever.
I think that's fine. Go ahead and accept it as a motion to implement a mask mandate.
Okay.
And then through your deliberation, you can, or with the assistance of your administration, decide separately an effective date of it.
Do we have a second?
I'll second the motion.
Okay. We have a motion and second, so that'll open it up for discussion.
Do I understand the mandate that masking for a certain period of time, then after that period, we reevaluate and to see if we need to continue or stop? Am I correct?
Yes, I think that would.
And what is the length of those, length of that period?
I think that we at least need to give ourselves 45 days to see where we're going. And this is from where I'm coming from, because of the fact that we have another variant coming, because our numbers have gone up, because we are in a situation where we need to protect children and give them the best education possible. I don't want to see that we have to close the school down because we end up getting another massive amount of kids and staff sick, and then we end up having to close school. We're not going to be benefiting by doing that. So I would like to really see, we can mandate the mask, I understand that. It's not our responsibility to ensure that all the people are using their masks, but if they care enough about their kids and they care enough about our staff, those masks will start being worn, and we will be able to protect each other. That's what I'm concerned with.
Okay.
So I'm hearing that the length of time would be 45 days.
And we would evaluate it. I mean, if our
Right.
numbers go down and things like that, then we can look at, not having to do it. But
We do, I feel like, need to discuss and decide before we can take a vote on this, what the effective date would be.
Yep.
Well, I would like to see that.
Do we need to close and clean before we do that? Has that been recommended, or did I hear that?
Well, that's what I thought, that we would need to do something like that before we could do this, to clean and get people healthy, that doing the mandate
But I want
today.
us to have something on the table that we are doing something about this, rather than the community to assume that we haven't done anything with this, that we've heard it, but that's all we're going to do. So that's what
Yeah, I understand that, but in order for us to have a start date for the mandate, we have to decide if we need to close and clean first, so we can get an idea when that start date should be.
Well, okay, so let me back up then, because I believe what you're suggesting, and that we have to discuss, is are we going to close campuses before implementing the mask mandate? Is that the question?
My question is, do we have to?
No.
Okay.
No.
There's my question.
Okay.
Why don't we do freedom of choice and satisfy everybody? What's wrong with that?
No, sir, please, no comments from the audience at this time. So we need to wrap back around to if what is the effective date, I would suggest that we would ask Dr. Trujillo how long he would need to prepare to implement if this were to be passed today.
Well, we would, if it were to be passed today, then we would work on communication with Ms. Weinberger and his team, and we're prepared to go in the direction, whichever way the board decides to go, and make it effective if the board wishes immediately.
Would we be able to go ahead and put it on the agenda for the meeting and vote on it then? Would you have enough time by then?
Okay, so let's back up. So then, what you're suggesting there changes the essence of what you're asking.
I'm just going based on
Okay.
what he's saying, what it's going to take to get it done, to get that, the
I think he's removing his first motion.
Well, let's clarify. So are you asking then that we consider this for an item at next week's agenda and not take action on this today?
I would prefer to take action on it today, but if we
Okay.
need the time and the school needs the time to get things, we could do it on the agenda for our next meeting.
So if your preference is today, then what we need to define is when you would prefer that effective date to be for your motion.
And again, we cannot do that without knowing how long it's going to take them to get the school done. So I'm looking at the fact that we probably need to go ahead and put it on the agenda for this coming meeting so that we can vote on it.
Are you withdrawing your motion?
Yes.
And let's see, Reverend had the second. Reverend, do you agree to the withdrawal of the motion?
No, I wish we would take action only one way or the other. And just for clarity, I think if we made the motion to wear a mask, it should be immediately as a part of the motion. And then move on that. And so, no, I do not wish to withdraw.
Okay, he didn't withdraw it. Well, he withdrew his original motion, so I think that would, Kelly, help me here. It's getting a little complicated that with that being withdrawn, the Reverend could make a new motion, correct? Okay.
So I would like to make a motion that we mandate mask for the school district immediately.
Immediately being effective tomorrow?
Effective on tomorrow.
Which would be September the 8th, for a period of?
45 days.
45 days. Do we have a second?
I will second that.
Okay. We have a motion and a second. That opens the floor back up for discussion.
I guess I am needing to say that we're making a decision with 1.1% of our students sick, and we've not even come close to the threshold that we had last year before we actually closed the school. And if we put this mandate on before we've done any teaching on how to wear a medical device, what are we going to get from it? I really think you're going to have students doing this with their masks and touching it. I know from experience, hand hygiene, when you wash your hands, it is good until you touch a contaminated surface. So if we haven't done the teaching we need to do so that children know how to do this, then we're wasting our time. I don't think we're going to get where we need to be. And Dr. Trujillo and his staff have done some great things throughout the summer with helping people get vaccinated, taking buses up into neighborhoods. I think that is why our numbers are so low. We are not Diboll, we are not Lufkin, we are Nacogdoches, and we don't have the numbers that these other places have. And we haven't. I mean, honestly, from Friday to today, it went down. So I don't think that this mask mandate is today. And I certainly don't think it's before we've done everything we can do to make sure that everybody is prepared and ready. We set a threshold before we would hit a closing a year ago. And that's kind of what I thought we were kind of leaning more towards, is kind of seeing, engaging, and judging, because we have done a good job in Nacogdoches. So that's my comments on that issue.
Any additional comments or questions from the board?
I have a couple of things to say. I have contacted some of my LTASB cohorts, and Tyler does not have a mandate, and Marshall does not have a mandate. And one of those two also gave this additional 10 days to their teachers. I think that's a real good idea. The second thing I want to say is last week, Miss Apt and I were in on a conference. It was a Zoom conference with the Deputy Commissioner of the TEA, Dr.
X.
Do you remember?
I said X, Dr. X.
And so we're there. There's 37 people. There are only 2 school districts that had 2 trustees. So, and you're going to have to help me, Leah Beth, because you might have an input on this. So his lead question was, he put us in groups of 3s to talk for a while and then come back and report to him. He says, "What keeps you up at night?" And what's really interesting is his reply, our reply to him in our report was, number 1 is mental health, and number 2 is, it basically is flexibility for local control. Flexibility for local control. Those are the 2, there are other things, but those are the 2 main things. And of course, that's not something we even discussed about today. But is there anything else you want to add to that? I thought it was very revealing, and this group from all across the state having this as the primary focus.
Well, I thought it was interesting that the districts having the most trouble, that were either having to go to a mandate or, like the ones in our county, were just closing down because of the rise. They were the small ones, and it had to do with staff. It was the staff, not enough staff because they were getting sick. And so I kind of am inclined to agree with Mindy that we need the encouragement here to get our staff to do what that would make them, keep them healthy, and then that would help protect our students as well. But our students, a lot of our students can't be vaccinated yet because of their age, and so that makes them vulnerable. So I have a question, if I can, unless you have more you want to add about that.
No, I forgot one more thing
Okay.
that I wanted to add. I think this gives us hope, because right now the superintendents have a regularly scheduled meeting with the Commissioner of TEA, Morans, every week on Thursday. But he said possibly that this would, the Deputy Commissioner of TEA says possibly this would lead to a forum for school board members, so that we could talk to other school board members like the superintendents are talking to the director of the state board of the TEA. And so we would be talking to each other, we wouldn't be getting a report every week, per se, but we would be able to get on a forum and address our problems and fine-tune things. And I think this is really a good idea if it comes about. But basically, instead of the title of this was Accelerated Learning in Post-COVID-19, which was misnomered. Because it's still continuing, and it's going to continue a long time. But I thought there are many different things that we are doing and we can do that will help our students. And I think, for myself personally, mental health is a very strong point of what we need to be addressing. And that's why we got more social workers, more counselors. We have more than ever before. And actually, I was over in Crockett and found they have one, or for sure one, but maybe two counselors for their entire school district. And so I don't think we understand where we stand here and the position we are right now, that we have fought the good fight last year, and basically the illustration I want to use is Dr. Trujillo walked in here with COVID going, and basically he's handed $1 million puzzle, a million-piece puzzle with no picture on how to put it together. A pandemic, no one's ever faced it. We have come out well, okay? And we are doing well. The question is what do we need to do, and when do we need to do it? That's the question to me.
Madam President,
I think Leah Beth had a question, so and then you'll have the
Well,
floor
my
next,
question's
Reverend.
to Mindy, and I'm genuinely asking because I kind of think you have more of an understanding and experience about this, okay? So the school districts, the very few school districts that, and this is what my understanding is, that have put down a mandate, their numbers were like, what, 10, 15%.
Yeah.
And I think you've made a very good point that ours are very low. So my question is, what do you think is a good number where we should then say, okay, now, instead of waiting till we have to close?
But that was the same question I asked Dr. Trujillo and said 7%, I believe.
I think that's what we
7%?
used last year. Just kind of going back to last year, and I really don't know that, I think it really boils down to, can you staff the school? And we were implementing strategy based on the needs of the campus, because we might have closed one campus, but we didn't close NISD, because there wouldn't have been a need to. But I think that when if you apply the cookie cutter to the whole district, then you're keeping other kids from learning. And I don't think that that's something we want to do either. I think we have to provide a way for kids to learn. I do know we used, I think, a 7% threshold, but I think Lufkin was at 15% when they made the call, and the superintendent did that because they couldn't have class.
Yeah.
So, I mean, if you can't have class, but then your goal is when you close, you clean, you give opportunity for the virus to run its course, because that's what viruses do, and then you come back to school and you do, I think we did do the mask for a period of time, but I don't think it's an indefinite thing. I think it's something you have to have an expectation for. What do we do next? I mean, the next big question is, so is COVID ever going away? And I would say no. We got to learn to live with it, not around it.
So, I'm still confused.
Okay. Reverend?
I was just going to ask, could we call for the vote?
Yes, sir. Absolutely. We've got a call
For the second time.
We've got a call for the vote. All those in favor, please indicate by raising your right hand and saying aye.
Aye. This is a call for the vote.
Yes. All opposed, raise your right hand, say aye.
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 Go, you can't vote twice.
Vote yes or no.
Voting no against the mask mandate.
Okay, I thought you were doing the question.
Okay.
Okay, so we
All right.
just started over.
So
Are we voting for the question?
the motion was to implement a mask mandate for 45 days beginning tomorrow.
Okay.
All those in favor, please indicate by raising your right hand and saying aye.
Aye.
All right. All those opposed, raise your right hand, say aye.
Aye.
Aye. Motion fails.
Thank you.
5-2. Thank you, Reverend. Do we have any additional motions?
Madam President, we had public hearing, comments, and this board likes to have, I call it public workers' comments. Recently, I've received 40 to 45 emails and 15 or more phone calls, some pro mandating masking and some in opposition, all concerning NISD's plans in dealing with COVID-19 and its Delta variant. I'm sure my board colleagues also have received those information. I am not a fast reader, however, I read every emails, and I profoundly understand parents' concern for the health and safety of their children, as my parents did. Most express their concerns very articulate, with calm, logical, and friendly tone, and Sam not so. I have a thick skin. However, I was disappointed by the name-callings, threats, and by calling us not having fortitude to make decisions. On my own behalf, yes, I am member of a team of 8, as someone mentioned, and which I call it member team of 1. At the same time, I am an independent thinker. I exercise my conscience in my decision-making, and yes, I have a fortitude to make decisions. Since the age of 14 till today, which soon to be 72 years old, I have made decisions that not only affected my personal life, but also my family and the lives of the students that I coached and taught for 36 years. Finally, my colleagues on the school board and our school's superintendent are all honorable people and are committed to the health and safety of all our students, employees, and faculty by creating the most conducive environment to educate our students for them to receive the best possible education.
Thank you, Mr. Nearbond.
Thank you, Coach.
Do we have any additional motions?
Did I just blank out, or did we not deal with?
We have not had a motion on that item yet. Would you like to make a motion?
I'd like to.
Yeah, go ahead and read it in the record.
That's why I didn't move.
Okay, resolution authorizing a one-time COVID-19 vaccination incentive stipend for all district employees who are vaccinated against COVID-19. Whereas the Nacogdoches Independent School District is a public school district located in Nacogdoches County, Texas, and whereas the Nacogdoches ISD Board of Trustees recognizes that COVID-19 is an unforeseen and unavoidable emergency of urgent public necessity, that the World Health Organization has declared COVID-19 a pandemic, that the President of the United States has declared a state of emergency, and that additional emergency declarations may follow in the coming days and weeks. And whereas since the inception of the pandemic, there have been over 4,792 cases of COVID-19 in Nacogdoches County, resulting in 184 fatalities. And whereas as of 4 p.m. September 6, 2021, the Trauma Service Area H, which includes Nacogdoches, Angelina, Sabine, San Augustine, Polk, Tyler, and San Jacinto counties, reported having only 4 intensive care unit beds available as COVID-19 related hospitalizations continue to increase. And whereas the Texas Education Agency and Department for State Health Services mandate that any individual that tests positive for COVID-19 must be excluded from school until the student or staff member meets the readmission criteria for COVID-19, resulting in substantial learning loss. And whereas the board has a substantial interest in protecting the health and safety of the district's students, staff, and community, and whereas as of March 23, 2021, the Texas Department of State Health Services declared everyone ages 16 and older, regardless of occupation or health status, eligible for the COVID-19 vaccine starting March 29, 2021. And whereas on December 18, 2020, the United States Food and Drug Administration issued an emergency use authorization for the Moderna COVID-19 vaccine. And whereas on February 27, 2021, the United States Food and Drug Administration issued an emergency use authorization for the Johnson & Johnson COVID-19 vaccine. And whereas on December 11, 2020, the United States Food and Drug Administration issued an emergency use authorization for the Pfizer-BioNTech COVID-19 vaccine. and on August 23, 2021, approved the Pfizer-BioNTech COVID-19 vaccine for individuals 16 years of age and older. And whereas, based on reasonable health and safety concerns related to the spreading of COVID-19, the board has determined that employee COVID-19 vaccination is vital, and whereas the board is authorized by Texas Education Code Section 45.105 to expend funds of the district for purposes necessary in the conduct of the public schools as determined by the board. Now therefore, be it resolved that the Board of Trustees of the Nacogdoches Independent School District, that the board hereby determines that the public purposes served by this resolution and any expenditure made pursuant to this resolution include keeping the district's students, staff, and community as safe as possible during the COVID-19 pandemic and maintaining instructional continuity to the greatest extent possible during the COVID-19 pandemic. A one-time COVID-19 vaccination incentive stipend in the amount of $500 shall be issued to all eligible district employees who provide proof of full vaccination within 30 days of the effective date of this resolution, or if hired after such effective date, within 30 days of hire, and remain employed with the district through the conclusion of the 2021-2022 school year. Eligible employees include all individuals employed full-time and part-time as of the effective date of this resolution, including permanent substitute teachers. All qualifying employees who are unable to receive the vaccine due to medical reasons shall be eligible to receive the one-time COVID-19 vaccination incentive stipend upon submission of medical certification and proof of completion of other mitigating measures, including weekly COVID testing and completion of health and safety education and training. Employees choosing to participate in the one-time COVID vaccination incentive stipend will be required to sign an acknowledgement and consent form. Payment of the COVID-19 vaccination incentive stipend shall be distributed and included in the employee's November 2021 paycheck. The district shall be reimbursed by any employee, with the exception of employees who resign for health-related reasons, who receive the one-time COVID-19 vaccination incentive stipend if the employee does not remain employed by the district, either voluntarily or involuntarily, through the conclusion of the 2021-2022 school year by withholding the amount of incentive from the employee's final paycheck. And the superintendent is authorized by the board to take such further action necessary and appropriate to implement the intent of this resolution without further board action.
Thank you. Thank you, Lisa. We have a motion. Do we have a second?
I say.
Mr. Neramond is seconding. Any questions or discussion? All those
on the people with health problems, it's voluntary. If they don't have to have weekly COVID testing unless they want the $500 stipend. So if they say, I don't want the stipend, they don't have to be tested, only if they have symptoms and desire testing.
That's correct.
They have to ask for it. But if they don't want it, they don't get the stipend, and there's no blood, no foul.
Correct.
That's what we say in basketball.
All those in favor, please indicate by raising your right hand, saying aye.
Aye.
Any opposed? Motion passes unanimously. All right, that takes us to our final item on the agenda. Do we have a motion?
I move that we adjourn.
We've got a motion from Mrs. Winslow. Do we have a second?
I'll second the motion.
Second by Reverend Irvin. Any discussion? All those in favor, please indicate by saying aye.
Aye.
Any opposed? Motion carries unanimously. Thank you very much for your time today.
Madam President?
Thank you.
Yes, sir.
I would remind us that